In this section, we will discuss the expectations of supporting students in extensions classes and best practices for feeding, toileting, transfers, and use of seclusion and restraints. As an EC teacher assistant, you will assist in the implementation of specially designed instruction, modifications, and accommodations per student's IEPs, provide physical assistance to students as needed for clothing management, toileting, feeding, positioning, and mobility. Assist with setup, use, and management of materials and/or technology devices. Collect data to document student progress on IEP goals. Act as a bus monitor when special needs of an EC student are identified in the IEP. Assist or monitor EC students with school-related functions on and off the school campus. Perform other duties to support EC students' EC programs as assigned by the EC teachers or school administration. Physical Needs Assistance, or PNAs. A PNA may be allotted to a school to support an EC student with significant physical disabilities who requires assistance for more than 50% of the day. In addition, schools containing an extensions program may be allotted a PNA to support multiple students with intensive physical needs on a year-to-year basis. For students who need physical assistance approximately less than 50% of the day, other EC assistants or school staff should be assigned to assist. Responsibilities are similar to those of the ECTA mentioned on the previous slide. How can you support in your EP classroom? By collaborating with case managers or EC teachers, supporting during direct instruction, supervision of students, providing physical assistance to students as needed in the areas of self-help, clothing management, toileting, including accidents and catheterization, and feeding. You could possibly act as a bus monitor when special needs of an EC student or students are identified by the IEP team. You will see students grouped for learning in extensions classrooms in many ways. A few are whole group, where all students are working in one group. Many times this is seen for morning meeting or reading a story. Small group, this may be to work on similar skills as peers or for peer modeling of skills being addressed. Independent workstations, some students need this for focus or to reduce visual distractions. These help them to focus on individual skills or goals. During whole group time, the whole class convenes throughout the day in a particular space. How you may be supporting in this space, you may be leading whole group lessons, read alouds inside of the U, or supporting 1 to 2 students while the teacher leads the lessons. You may be assisting with therapy activities. Just remember that these spaces may look different from classroom to classroom depending on space and setup needs of the class. During small group times, you want to make sure that you have enough small separate spaces for staff to be able to use at the same time. You may be leading academic rotations, IEP goal focused activities, or supporting for therapy pull-out or separate space activities. You'll see independent workstations utilized for mastered skills and for students to increase their independence. These may be used with or without para support, and the goal is to fade prompts and supports. How you may see these used and how you may support is in workstations during technology time or quiet sensory time away. Many extensions program classes will have cool down or break areas for students who need to reset or have a break from the class or activity. This may be used independently or with support from adults. On this slide, you see some other examples of classroom setups. There is no right or wrong, but what's going to work for the students and the physical space that you have. In the event that you are supporting in a virtual setting, remember to ensure that you have access to the teacher's Teams or Zoom information, or have your own set up if needed. Ensure you have access to materials, online or hands-on, for the groups or lessons that you are leading or supporting in. Next, we will discuss best practices for safety during feeding or meal times. Preventing aspiration when feeding students is very important to their safety. Students should sit in a midline and stable position with head upright and not tilted back. Try swallowing with your head tilted upward. Yep, it's hard. We do not want the CPR open airway when eating. If the student is in a wheelchair, hips should be back as far as possible with a snug pelvic lap belt. Wheelchairs should be as upright as possible to maintain upright head alignment. If needed, stabilize the student's head briefly to get food in their mouth, then remove your hand while the student manages food. Tips for assisting students with feeding needs. Do not place fingers inside of a student's mouth. Do not scrape food off the spoon by using the child's teeth. Wait for lip closure, then remove the spoon. Avoid using the spoon to clear food from the child's chin. Use firm blotting to wipe the mouth rather than wiping. Integrate communication strategies. For example, using the Big Mac for them to say, "I want more," or "drink please," or "yes, no" to make their food choices. If the student's tongue protrudes forward, apply firm pressure to the tongue with a loaded spoon between the middle and the back of the tongue. This will often cause the tongue to relax and retreat. If the student has excessive hand movements and difficulty holding the utensil, then one hand may need to be stabilized. Fade support away once the student grabs the utensil. Remember to refer to your OT, PT, and speech therapist for support with feeding students. Some students may require a diet order. Your case manager or EC teacher in the classroom will communicate with you if a particular student has a diet order on file and what their unique mealtime needs are. The documents you see on this slide are available for review on the resources page. Refer to the classroom teacher or administration at your school for the latest documentation for mealtime needs. You may have students who have mealtime needs procedure cards. These are in place to support students with unique needs so that any staff working with them knows what those needs are. Next, we will discuss best practices for supporting students with toileting needs. It is important to follow restroom procedures for your safety and the safety of students. Wash hands for at least 20 seconds. Put on gloves and other protective items as indicated. Place students' personal supplies within hand's reach. Follow the established restroom procedures for each individual student. Individual student restroom procedures should be created and documented in collaboration with the nurse, physical and/or occupational therapist, and reviewed periodically. Always stand beside the student when using a changing table. Dispose soiled materials, including gloves, in a tied plastic bag in a plastic-lined trash receptacle. Wash hands after removing gloves. Clean and disinfect changing table adaptive equipment after returning the student to class. There are many types of equipment a student may need in the restroom. A few examples are seen here: wall rails, toilet safety frame, handheld urinal, flip and flush, blue wave and base, or blue wave attached to a toilet. When using restroom tables, Be prepared, have supplies within reach, never leave a student unattended on a table, and be sure that a high-low table does not rub against the wall or the wheelchair for proper functioning. Good body mechanics for transfers are important so you do not get injured. We will discuss that further here. For stand pivot transfers, make sure that you use proper body mechanics, use techniques taught by PT for individual students, start stand pivot transfers as early as possible for students who can bear weight through their legs. Use stand pivot transfers consistently to promote less dependence later in life. For a one-person dependent lift, be sure to use proper body mechanics, use with students who are unable to physically participate in transfers, use techniques taught by PT or OT for individual students, and communicate steps with the student and partner. For a two-person dependent lift, use proper body mechanics, use with students who are unable to physically participate in transfers, use techniques taught by PT or OT for individual students, and communicate steps with the student and your partner before moving. Supporting students in wheelchairs safely is important. Essential components for using wheelchairs. The pelvic positioning strap or lap belt should always be the first strap secured when placing a student in a wheelchair and the last strap unfastened when taking a student out of a wheelchair. Double check the pelvis positioning strap to make sure it is fastened before moving the student's wheelchair. Wheel locks. Both wheel locks must be secured when a wheelchair is at a desk or parked anywhere. Contact the school PT if wheel locks are broken or not functioning properly. For power wheelchairs, they may have a mechanical locking system. Please consult with the PT regarding these chairs. For proper positioning of students in wheelchairs, engage both wheel locks. Make sure the student's pelvis is all the way back in the seat and is level. Secure the pelvic strap snugly. Lean the student forward to make sure that the student's pelvis is against the back of the wheelchair. Secure the chest straps, if present, by securing the bottom buckles first and then securing the top buckle. Make sure the chest strap is not too close to the student's neck. Some reminders for wheelchair safety. Check to make sure the pelvic positioning strap is secured. Lock both wheels whenever parking the wheelchair, even if leaving the wheelchair unattended for a brief period of time. Locking one wheel lock is not sufficient to keep the wheelchair from moving if bumped. Do not let go of the wheelchair or park a wheelchair on an incline, near steps or curbs, or on uneven surfaces. Do not allow another student to push a wheelchair outside, inside only when approved and with an adult. This section we will discuss a few important reminders about seclusion, isolation, and timeout use. Seclusion is the confinement of a student alone in an enclosed space from which the student is physically prevented from leaving by locking hardware or other means, not capable of leaving due to physical or intellectual incapacity. Isolation is a behavior management technique in which a student is placed alone in an enclosed space from which the student is not prevented from leaving. Timeout is a behavior management technique in which a student is separated from other students for limited periods of time in a monitored setting. For example, a student may be asked to step out in the hallway. A student is moved to a desk in the back of the room while other students are still with the whole group in the front of the classroom. This chart shows the differences and similarities between seclusion, isolation, and timeout. Seclusion is not a behavior management technique, and we do try to focus on behavior management techniques. We do not use seclusion. We've seen an increase in inappropriate use of mechanical restraints in our classrooms. Students have been injured, staff have lost their jobs, and in one situation, a family member called in the police when a child was strapped into another student's chair. By understanding the proper use of mechanical restraints, we will prevent these situations from happening. A mechanical restraint is the use of any device or material attached or adjacent to a student's body that restricts freedom of movement or normal access to any portion of the student's body that the student cannot remove. This slide shows types of mechanical restraints that could be used. A mechanical restraint will be documented in the student's IEP. You will receive direction from either PT, OT, or the student's case manager regarding this. Before using a mechanical restraint, staff would utilize behavioral strategies that we will discuss later in this presentation. School bus safety. You may ride with a student if the IEP teams decide they need additional adult support or during school field trips. There are 3 types of child safety restraint systems that are used on CMS buses. The integrated seat is built into the bus seat and is exposed when the vinyl panel is pulled down. The Star Seat is a student transportation add-on restraint that is used on buses that don't have integrated seats or if all of the integrated seats are filled. The new buses only have the integrated seats on the first 2 rows. The Safety Vest, a system used for students who inappropriately unbuckle themselves or for those who weigh over 90 pounds. Please remember that safety vests are safety vests, not harnesses. We do not want to tell our parents that we are going to harness their child. Of course, anytime we are going to use a restraint, it must be documented on the student's IEP under the accommodations section. Please work with the case manager to ensure this is in the student's IEP. A few reminders when you are loading and unloading wheelchairs. Make sure the lap belt is snug and secure. Back the wheelchair onto the lift. Lock both of the wheel locks. Keep a hand on the wheelchair frame while the lift is raised to detect movement so the lift can be stopped if needed.